This video is concerned with entering of the consultation, assessment and investigation. I have to go back to the newly created patient in Podiatry World X Center, and we are going to have a general podiatry consultation. You will see I have selected a GP referral, and selection of the provider environment is then determined, and in this case it is NHS community based. The next stage is to input the patient risk assessment. Wherever you see a green circle, there is the option to hover over and explanatory notes will appear. You can then select the score pertinent to the referral. The free notes text section, which is optional, will allow you to enter information from the referral should you wish. I am now going to move into the episode. It is pertinent that I want to make it relevant to the referral. The consultation is the first step in this process. Entering the correct date is done via the free text, or the scrolling function can be used. The clinician that saw the patient needs to be entered, and as I am the only one here, I am selected. The clinical decision is noted from the drop-down. The referral was concerning an ingrowing toenail, and following the consultation, I have determined we are moving towards nail surgery. Free text is also an option here too. As part of collecting further demographics of patients, we are seeing there is the option to enter the medical diagnosis related to the patient. I am able to scroll through the drop-down menu, as well as free text type to choose from the list. In this case, no additional information was noted. Podiatric diagnosis is the next section, and will, when completed, allow the centre to begin building up a picture of the numbers and types of patients you are seeing within your practice. In this case, I have noted ingrowing nail. You can add up to 5 podiatric diagnoses should this be appropriate. Within the event options, there is a generic assessment tool and allows for the collection of blood pressure values, pulse rate, height and weight for auto calculation of BMI. And for those in the diabetic world, ABPI, transcutaneous oxygen, and the Texas wound score when reviewing and categorizing the wounds that you are seeing and monitoring. The event date, in this case the assessment date, can be recorded also. At this point, we can also now record any investigations that may have occurred. Again, the date can be amended appropriately. The allocation of clinician involved and investigation that took place. Although not pertinent to this event, I am showing you the use of noting plain X-ray and how you can then record the results. If awaiting results, this can be noted in the drop-down as well as other reports. The free text functionality is useful here, as when the report is provided, the narrative can be recorded for reference later on. You may input a number of investigations, and should this be relevant, click Save, and you can add another, but if not by clicking Save and Close, it will take you back to the main patient record.